Okay, so we know what causes C. diff. So the best treatment for C. diff is to pretty much reverse everything. We definitely want to make sure patients are placed on contact isolation with hand washing. And if you suspect the patient is at high risk, put them in protective isolation with hand washing. That is a nursing measure. You do not have to have a physician's order to provide your patient with protection. So we want to discontinue any antibiotics that are known to place the patient at a higher risk of developing C. diff. Those are the ones that actually kill off our healthy flora. So they may just need to be changed to an antibiotic that is not known for that. If they are on PPIs and or H2 blockers for stress ulcer prevention, then let's go ahead and get those discontinued. They would only need to be continued if the patient does have the presence of peptic ulcer disease. Would rather treat gastric esophageal reflux disease with putting the bed on an incline as opposed to chronic use of PPIs and or H2 blockers. The major thing is we really need to repopulate the gut flora, and this can be done with the help of a willing physician by use of a household donor of stool. People that live in the same household tend to have the same gut flora, so getting a stool specimen from a family member that lives with the patient would be ideal. Again, you have to have a physician, a gastroenterologist that is in agreement with performing this type of procedure, and of course the patient would need to be willing. You would want to provide plenty of education and rationale behind this particular procedure, as some people are kind of put off by the thought of receiving a stool donation. We want to increase the patient's fiber to ideally more than 30 grams per day. Normal should be right at 30 grams per day, but we really need to get that gut repopulated. Fresh vegetables and fruits are ideal if the patient is tolerating a diet. They're still going to have diarrhea until the toxins are diminished. But hopefully replacing that gut flora with the fresh fruits and vegetables, grains that are complex, that are high in fiber, really exposing that gut to those healthy flora and giving them the food that they need. Yes, the patient will have some increase in gas, but it's better than having to have a colectomy. And then, of course, active or live cultures, whichever the physician prefers. We can get, if the patient doesn't have a dairy intolerance, then of course we can get them some yogurt that has active cultures in it. And then we can also give these via capsules as well. Lactobacillus is a very popular one. The patient, depending on the severity of the C. diff infection, they may need prescription therapy. That is done with oral vancomycin paired with oral flagyl as well. Many times the patients have to be on this therapy for 6 weeks. This can be prove to be quite costly for the patient. Both of these medications are usually given 4 times a day, so just kind of keeping that in mind. If they don't have good insurance, they may not be able to afford this and may not continue with the therapy. If they remain in the hospital setting, then that may actually be performed